Welcome to the video on EMS documentation, improving medical necessity statements. In the world of EMS, if it isn't documented, it didn't happen. This video provides tools to document non-emergency transports precisely to satisfy medical necessity criteria. Medicare Part B ambulance payment rests on three pillars: physical transport, compliance, and medical necessity. The patient's condition must be severe enough that an ambulance was the only safe option. Your narrative must document all three to ensure payment. For non-emergency transport, the patient must be bed confined, or their condition must make other transport unsafe. Objective documentation bridges the gap between diagnosis and physical presentation. Document specific signs, symptoms, and care received to justify the ambulance. To be bed confined, the patient must meet all three criteria: unable to get up without assistance, unable to walk, and unable to sit in a chair, including a wheelchair. There is a key distinction between bed rest and bed confined. You must document the physical incapacity. To prove medical necessity, provide objective documentation for 5 areas: signs and symptoms, underlying diagnosis, mobility status, special skills or monitoring, and special equipment. Documenting all 5 justifies why an ambulance was the only safe option. Proving medical necessity involves the 3 why categories: physical why for mobility, provider why for special skills like monitoring, and tool why for special equipment like a stretcher. Specify the exact medical monitoring and equipment used to document necessity. This example of tools why demonstrates the need for special handling. The patient has respiratory MRSA requiring isolation and vehicle decontamination. This need medically contraindicates other transport and justifies the ambulance. This provider why example involves COPD and dementia. Due to cognitive impairment, the patient cannot maintain their oxygen device and requires frequent monitoring and clinical intervention. This need for a trained provider medically contraindicates other transport. This physical why example shows a patient with hemiplegia from a CVA. They cannot ambulate or maintain an upright seated position. The need for total assist lateral transfer via a stretcher makes other transport medically contraindicated due to safety risk. The mission is audit-proof documentation. Your PCR bridges the gap between medical history and present care. Specify mobility limitations, detail specialized care, and document required equipment. This ensures the ambulance was the required safe option. In the TraumaSoft ePCR, the stretcher purpose description field is limited to 80 characters. You must use the narrative to fully expand on the physical why, provider why, and tool why. Make sure your billing summary is backed up by detailed clinical findings in your narrative. If you have any questions about this material or documentation for your patients, please reach out to a member of your clinical care team. Remember, "They needed us" is just an opinion. Document the why for medical necessity.